Well, let's wrap it up with this is because this is going to be the biggest question most people have is like, okay, great. I understand the basic concepts here, Chris and Colby, but, Medicare supplement versus advantage, if I'm really trying to make that decision, because that decision is the one that could maybe financially affect me later if I change.
Yeah.
What questions should I be asking? Let's go into that.
Okay. So the biggest one for me is always budget, and now and always in the future. Maybe you can afford that Medicare supplement now, but can you afford it when it's 3 times the price for 2 people in 10, 15 years?
Okay.
And can you afford that for the rest of your life?
Sure.
So that's a big consideration when choosing a Medicare supplement plan. And I have this little anecdotal story I really like to tell. So my uncle chose a Medicare supplement plan when he turned 65. He had a bunch of different doctors he went to, and he had multiple primary cares. They were all diagnosing him for different things, giving him medications, and he assumed that they were all communicating, and they were all giving him these different medications for the same thing, counteracting each other, and it wasn't working out for him. And so it was also getting incredibly expensive for him. The medications, the supplement, all this stuff. As he got older, it got more and more complex, and he couldn't afford it anymore. His health was taking turns. So a Medicare supplement plan just wasn't right for him. He wasn't managing his health care. He couldn't afford it, and it just wasn't the right choice for him, where he really should have gone to a managed care plan from the beginning, so that way all these things weren't happening. So money is a big consideration when we first look at this stuff.
Sure. All right. Especially if the premiums can change in the future, or things can change, your health can change, whatever it may be.
Yeah.
All right. And then medications, is that a big thing that people should be concerned about when they're looking at supplement versus Medicare Advantage?
Yes, and it's becoming especially true with the changes coming in 2025 to Part D. So prescription drugs are already really complicated, and a lot of them are very expensive. So we really have to consider which plan you're going into and which option. A lot of the times Medicare Advantage plans, they're getting a lot more money than the 40 cents they're getting for the prescription drug plan. So they can have better coverage than compared to an individual plan. So it's really important to consider which one you're going to go with for the future and now if you are on expensive medications.
Got it. So if you're considering Medicare Advantage or a supplement, make sure to really think about your budget today and the future. Think about the medications that you're on, because you're right, that medications are a political hot button too nowadays, and that could change in the future. So outside of those 2 things, what else questions should somebody be asking?
The other thing, one of the main questions I ask when I meet with people first is, who are your doctors, and is there a particular hospital that you want access to, or a facility, or something that's really important to you? Sometimes you have a surgeon that did your back surgery 20 years ago, and that's the only guy that knows your back. Well, you don't want to lose access to him by choosing a Medicare Advantage plan that has a narrow network, and that doctor doesn't accept it. So looking at your list of doctors and what facilities you need access to is the most important thing to me, because that's who's going to take care of you.
Sure. So this is very similar to like if you had a job change while you were working and your insurance changes, you need to look at, hey, are my old doctors on the new insurance plan? So this is very similar, just on a higher government level in essence.
Yeah, basically, exactly.
Okay, interesting. All right, so knowing what doctors you have, prescriptions, your budget, what's the last thing people should be asking themselves, or one additional thing they should be asking themselves?
Yeah, and it's of course, do you have any particular health conditions, right? Do you have diabetes? Do you have a certain heart disease? Do you have any other disease that requires special treatment and special medications? Is very important, because maybe you have specialists that you need to go see, and that best specialist is in a different state or a different county. So maybe you want access to them. There are special Medicare Advantage plans designed for people with certain diseases like diabetes, heart disease, emphysema, that help you manage that condition and reduce the medication costs for you, which can be really high for people with certain diseases. So that's also a really important consideration, to make sure that it's going to fit in with all these other things, right? It's going to fit in with your budget. It's going to fit in with all of your medications and your doctors. Do you need special attention?
Interesting. All right. Well, I appreciate your time today.